Good afternoon, guys. Thank you for clicking on my channel. If this is your first time to visit Panlasang Kabute, let me introduce myself. I am Nurse Malin and my advocacy is to promote palliative and hospice care in the community through empowering the volunteers. And since October 10 is World Hospice and Palliative Care Day, we'll try to celebrate it by paying tribute to those who are very passionate and champions in the field of palliative care here in the Philippines, and for their dedications in helping patients and families with special needs. We'll also try to accompany them in their home visits, virtual nga lang, for us to see what they do and for us to identify as a volunteer what can we help as part of interdisciplinary team. So tara, mag-home visit tayo and kilalanin natin ang mga champion sa field ng palliative care.
This week on Profiles, we get to know Dr. May Corvera, who passionately champions palliative and hospice care.
Siya guys, si Dr. May Corvera. Siya ang isa sa pinaka-passionate na doktor na nakilala ko pagdating sa palliative care. Marami pa rin doktor na very passionate pero isa siya sa pinaka.
Even before she became a full-fledged doctor, May knew she had a calling for palliative and hospice care.
I came in as a first-year resident, but as early as that, you would see already patients being referred to us as family medicine. And we're told that these patients have been in the hospital too long, they take up a bed, and they need to be sent home because there's really nothing that can be done in the critical care unit anymore. So we're referred to for home care.
Mga patient na usually sinasabi ng doktor na hindi na nila kayang i-treat sa hospital, pinapadala yan sa bahay, pinapauwi na sa bahay.
After years in the field of family medicine, in 2013, she put up the Ruth Foundation for Palliative and Hospice Care to fill the gaps she had experienced firsthand.
Dito sa Ruth Foundation, ito yung dati kong work as a palliative nurse. Wala na ako sa ngayon sa kanila, pero lahat po ng natutunan ko ay nagmula sa kanila. Sila yung naglagay sa puso ko kung paano magsilbi sa kapwa, sa mga pasyente ng may pagmamahal at buong puso.
In just 5 years, the Ruth Foundation has touched the lives of more than 5,000 patients across 18 different municipalities. They've cared for patients from as briefly as 10 hours.
Kung mapapansin nyo guys, mga elderly yung binibisita nila, yung mga previous na pinakita. Sa start kasi ng foundation, ang mga targeted patients muna namin doon ay mga elderly because we believe na sooner or later kailangan nila yung palliative care, whether they like it or not. Kaya hinahanda na natin sila at ang kanilang pamilya para pag dumating na yung time na kailangan na nandun na sila sa sitwasyon, hindi na sila mahihirapan sa kung ano man yung nararanasan nila, na kahit papano ay may hope sila na mararamdaman.
Varying in age and illness. What May feels is the team's greatest achievement, though, is successfully spreading the word on palliative and hospice care.
Not many people are really familiar with what exactly that is and what exactly palliative and hospice care is.
Their general understanding is really, it's associated with death. For those who have heard it, it's usually end-of-life care only. That's what strikes them first. Oh, we're not ready for
Yes, totoo naman, di ba? Pag sinabi natin palliative care, ang notion ng iba ay it is pagkamatay. Ito, makinig tayo kung ano sabihin ni Doktora about the definition of palliative care.
ready for that, or you
don't want to talk about it.
Let's not talk about that yet. They don't know that it really involves holistic care, and the highlight should be really quality of life, not quality even of death. The goal is really to transform suffering by means of preventing it, anticipating physical symptoms or pain that may lead to suffering, and even the psychosocial aspect of suffering is anticipated. There have been studies that show that it actually lessens the burden of cost, because especially if you're referred early, the goals of care are well
Sa palliative care,
defined.
guys, sabi nga ni Doktora, holistic, pag sinabi natin holistic, yung kabuuan na pagkatao ng isang pasyente at ng relative. Nandun yung physical, psychosocial, spiritual, and yung emotional nila. So, yun lahat yun ina-address.
Care is lessened.
Yeah.
And the family works alongside the physician to care for this patient.
May can't stress enough how crucial palliative care is to public health care. Nearly 5 million senior citizens need to be cared for in the Philippines. 2/3 of Filipino children with cancer are diagnosed at advanced stages, and their survival rate is less than 20%. Throughout the country, only 2 hospitals have a hospice ward, and no more than 50 non-government organizations are providing palliative and hospice care.
Di ba? Isa sa dalawang hospital na merong hospice ward ay ang PGH lang. So, alam mo yung ang daming nangangailangan ng special care na to, pero walang mga facility. Hindi tayo ready sa ganitong klase ng pagkalinga. Yung ating healthcare system ay hindi kasali ang ganitong klase ng mga pasyente.
The Philippines is listed as one of the worst places in the world to die due to a lack of palliative care professionals, public services, and government support. And ultimately, 100% of the
Nakakalungkot, di ba? Ito po yung sinasabi ko noong nakaraan pa na ang Pilipinas ay isa sa pinaka-worst. Kulela tayo pagdating sa pangangalaga sa mga pasyente, mga pasyente na medyo may advanced na sakit. Pang 78 tayo out of 80. So ito yung guys yung nag-drive sa akin ngayon para mas magbigay ng awareness sa kapwa ko Pilipino, para magkaroon tayo ng tulungan sa komunidad. Mapaangat natin ang bansa natin na hindi tayo pang 78. Kailangan natin maging mas maipakita natin yung bayanihan sa kapwa sa pamamagitan ng pagtulong sa kanila kung ano man yung kaya nating ibigay. Sa ganun yung 78, at least man lang maging 50, maging 40, kasi kilala tayo ng Pilipino bilang isang caring na individual. Patunayan natin yung guys
driving force behind May's passionate lobby for palliative care to be included in the country's universal health bill. May is absolutely thrilled about the Senate's recent approval of the bill last October 10, 2018. But before this becomes law, a bicameral session is needed to reconcile the different provisions of the Senate and House of Representatives version.
Si Doktora may sumulat siya sa Senado na i-include sana yung palliative and hospice care sa healthcare bill natin. Ayun, kakatawa, di ba? So, champion talaga siya pagdating sa palliative and hospice care. Walang limitasyon yung kanyang pagmamahal at pagbibigay ng suporta sa field na ito.
Representatives versions.
At least palliative care has its foot in the door, so to say. If it's approved, I believe all government hospitals at least would have to set up a service. But that's just the start of the work. You know, we have to empower people to provide the service.
In the meantime, the Ruth Foundation is doing its best
So guys,
to bridge the
yung
gaps.
mula sa dalawang hospital, kung ma-approve itong bill na to, lahat na ng hospital ay isa-set upan ng palliative and hospice ward. So, di ba maganda? Yung ginhawa kahit papano na may nakaalalay sa kanilang doctor and medical team. Pero hindi naman lang kasi hospital pwede magbigay ng tulong sa ganitong mga klase ng pasyente. That's why we are here, community setup, sa ating komunidad, sa ating mga kapitbahay. Pwede rin naman tayo magbigay ng kalinga sa ngayon, sa kung ano may kaya natin gawin.
Their home visits, called Care Encounters, send out holistic teams to bring palliative care to the doorsteps of those who need it most.
His residency training, she was my senior and then eventually became my chief resident.
Saludo kay Doktora. Napaka-holistic na approach niya.
Some of the most valuable lessons I learned from Dr. May is use your talents. Go beyond yourself, your practice, your family, and serve other people. She's a great inspiration for everyone.
And that's why we are here po, Doktora Nanet, Doktora May. I am going beyond my capacity. I am going beyond my talent. Ito ang alam kong way para kahit papaano makatulong ako sa inyo, sa kapwa ko nurses, na kahit papaano gumagawa ako ng paraan para magbigay ng awareness sa ating mga kababayan tungkol sa palliative and hospice care, kung paano sila makakapag-volunteer, kung paano sila makakatulong sa kapwa din.
Tumawak yung services, yung provisional services to really indigent people. The focus is really for those who are suffering. Yun yung pinaka-importante.
Maybe people think there's no more hope.
Oo,
So
totoo.
it's just all about the patient, but it's actually, as you said, holistic, also thinking about the family. Can you tell us what it means for the caregiver or a palliative doctor?
When you're alone, it's very difficult. As I started, I thought I could, just go out there and do it myself. But then I realized you can't. It really needs a interdisciplinary team. You have to really sit at least not less than 30 minutes with a...
So sa team, nandun yung doctor, nandun yung nurses, nandun yung pharmacist, nutritionist, massage therapist, and volunteer. Napakalaking bagay po kapag tayo ay nasa team. We are part of interdisciplinary.
minutes with the patient and the family to assure them that you're there for the long run, and they can call on you, and you have to establish that connection. You have to be a team to care for them.
Yeah, that's why the community is so important.
Yes, and that's another part of our advocacy, Mitch. We need to start having these conversations.
Yes.
It's really a community approach, because some of the referrals come because they don't know what to do, and they want to just be able to talk about what to do.
Community empowerment is another thrust of the foundation.
Isa to sa kayang-kaya natin gawin. Di ba tayo nasa barangay, mga kapitbahay natin, kung may mga kilala tayo na may sakit, pwede natin silang tulungan. Community empowerment. We try to involve everyone para sa kapakanan o para sa gamutan ng isang, hindi siya gamutan, pero para sa pag-aalaga sa isang pasyente at kasama yung kanilang mga pamilya. So, involve natin ang sarili natin. Kung may kapitbahay tayo, pwede naman natin silang tulungan sa paraan na kaya lang natin.
And for physicians. So, we are hoping to continue spreading programs.
Ultimately, May hopes that no one has to die alone and in pain, that everyone will be surrounded by a compassionate community of care.
No one has to die alone. Kailangan ma-feel ni patient na hindi siya nag-iisa. Sa kanyang battle, nandun tayo. Ang pamilya niya, nandun tayo. Hindi man ganun kadami ang kaya natin gawin, pero yung ma-feel lang nila na may kasama sila, may nakikinig sa kanila, may karamay sila, malaking bagay na yun sa kanila.
To get a clearer picture of May's advocacy, I tagged along on her care encounters.
I used to do this before.
Ito na, home visit na tayo, sasama tayo sa kanila. Pero guys, may mga dapat tayong tandaan kapag mag-home visit sa isang pasyente. May mga bagay tayo na dapat munang pag-aralan sa ating sarili at pag-aralan ukol sa pasyente. So, hindi naman basta-basta rin na kung gusto mong mag-volunteer, pwede ka nang sumama kagad. May mga bagay na tayo na dapat munang pag-aralan kahit pa paano. May mga guide naman yan. Ito na home visit.